You know, as a physician and in medicine as a whole, information is really the lifeblood of what we do. Sandlot provides information at the point of care when I need it and the right information that I need to make the best decisions for my patients. In many situations, we're faced with taking care of a patient with an insufficient amount of data to make the best decisions. And really, Sandlot has enabled me to be a better physician by accessing information that comes from across the entire community, from the hospitals, emergency rooms, other physicians, electronic health records, as well as laboratory and x-ray information that comes together as a single, unified patient electronic health record that I can then access at the time the patient is before me. In addition, we deal with a lot of patients in which there's a very complex array of illnesses, various diagnoses, multiple medications. They have many providers of care, physicians, cardiologists, neurologists, and all. And I'm trying to coordinate the care for those patients. Sandlot enables me to get, again, the information I need at the time I need it, but also provides the ability to create reminders, alerts, to re-emphasize the importance of quality measures in taking care of those patients, and to also better communicate with the community physicians that are also caring for those patients. Well, security, of course, is paramount, and in fact, it's probably the single most important initiative in the development of community data repository for health records. If you're going to improve the health of your community and improve the public health, then you need more information available to you. To do that requires trust. You cannot get hospitals, physicians, and other healthcare entities to share their information without that trust. We've been very successful in developing technologies which involve encryption, limitation of data access, an audit process, and a whole host of other technologies to protect that information, but also to provide the information when needed to those with access who need information to improve the health of our community and our patients. Mildred, it's very fortunate that you live in a community that has Sandlot, because I'm able to access information about your care that has occurred in other parts of the community, which helps me make better decisions for you. And I've noticed here on your record that you list several problems, and you have a primary care doctor, Dr. Lonergan, who provides most of your care. Mm-hmm. Okay. And it looks like I see you were in the emergency room a couple of months ago.
Yes.
You had some pretty bad abdominal pain. They did some x-rays. Looks like those checked out pretty good.
I think so, yes. I can't quite even remember what all they did, but yes.
Well, we're fortunate that all of that is actually available to me in the HIE Sandlot. The other thing is you had a blood count, showed you were a little bit of anemic.
Mm-hmm.
You know, has that been followed up? Do you know?
Yes, they gave me some iron, and I think that's doing okay now.
Good. The nice thing is I can access and see all your medications, even though I didn't prescribe the medicine. Other doctors may have. We can see all the medicines that you're taking, as well as a number of the reports and consultations if you're in the hospital and that kind of thing. So it looks like you're actually doing pretty well. Have you seen a heart doctor, Dr. Vignes?
Oh, I think so. I think it's been a few years.
Okay. You know, it's very difficult to get physicians to change the way they always do things. So our focus with our physicians, with Sandlot, has been to create information technology tools that fit within their normal workflow, that really require them to disrupt their normal patterns as little as possible. And in addition, those tools allow them to be more efficient, both the physician and their staff, spend considerably less time in gathering information about the patient, which makes everyone happy in the office. Better decisions made more efficiently. Once you've built that value proposition for the physician, it's hard to get them to go back. They find that it makes them better physicians. They find that their time is used more efficiently. And once they get through the change process and have that value in their practice, they're very happy to not only adopt and continue to use it, but to promote it among other physicians as well. You know, one of the things that physicians and really all providers deal with is sorting through a whole host of information and really deciding what's important, what's relevant, what do we need to know, what do we don't need to know. The digital envelope technology essentially delivers the information I need when I need it, and in the process of taking care of that patient, it simplifies the process of improving the quality of their care, making sure they get appropriate preventative care, make sure that I'm reminded to do the tests that actually need to be done, and it's very timely. It's when the patient is in front of me. These digital envelopes are essentially built around our electronic data warehouse, which is queried based on certain clinical guidelines that we've developed and designed for patient care. For instance, if I'm seeing a patient who's over 50 who should have had a colorectal cancer screening test, and they have not had that test, and our data warehouse shows that they have not had the test, then I will get a notification through this digital data envelope that tells me this patient needs colonoscopy screening. It's a very valuable adjunct in improving the efficiency and overall quality of care, which again is enabled through Sandlot and our electronic data warehouse. Five-star plan is relatively new within Medicare Advantage. It is an excellent program because it truly does incent improving the quality of care for patients, focusing on care quality, access, patient satisfaction, a whole spectrum of very good measures. You know, we've been doing Medicare Advantage programs for the past 15, 16 years within a DSP. And we found that in the past few years since the STAR program began, we have increased our STAR ratings from 3.5 to a 4.5 level based on the tools that are provided through Sandlot, the Health Information Exchange, as well as the digital envelope, which now provides reminders and alerts to us so that we can assure that we're achieving those measures in a timely way. You know, beginning in January of this year, we are participating with the Medicare Pioneer ACO with North Texas Specialty Physicians and Texas Health Resources Hospital System. This is a new model. It presents new challenges. And we found very early on in looking at the data and looking at our patient population that Sandlot was extremely important in providing the appropriate analysis of these patients and getting the information we need to provide their care. In addition, the metrics and the digital envelope technology adds even further on our ability to measure the quality of care we're delivering and to make sure it is also cost efficient. You know, the delivery of value in healthcare is the future, and Sandlot is going to be part of that future. With the evolution of the ACO, the future is right now. You know, The entire value of health information exchange depends on what information is included in the exchange. In any community, patients receive care from multiple parts of the community: hospital systems, emergency room, physicians' offices. To have a really effective information exchange, you have to pull information from multiple sources. That's why it's important for competitors in the community to understand that by sharing information, they actually gain in their ability to provide better care. We've been fortunate in our community with Sandlot that we have information coming from multiple physician offices through multiple interoperable health information records. We have hospital systems connected, labs, x-rays, and by bringing that all together into one in a community, we have a much more robust patient record that allows us to provide a better care for our patients. For any HIE or other technology to be sustainable, it really needs to provide two things. It has to improve the quality of the care delivered, but it also has to have a pretty strong business case behind it, justifying the cost that's invested in creating that technology. For Sandlot, we've created that sustainability model based on the fact that our physician groups manage Medicare risk and ACO risk. So that the more effective we are at improving the quality, avoiding bad outcomes, adverse events, and lowering total health care cost, the better we are reimbursed for those services. So the HIE in that scenario is a clear winner. And Sandlot has enabled us to do both of those. We have increased the quality of care that we deliver in those settings. We have also lowered the cost by eliminating redundancy, unnecessary services, avoiding adverse outcomes, readmissions. Those kind of products from using Sandlot essentially makes it very cost-effective and sustainable. In fact, Sandlot was recognized in the past year or so by the eHealth Initiative as being one of the most sustainable HIEs in the U.S. Largely around that model, we create incentives for our physicians to use and apply the HIE, and that has been successful as well in increasing the adoption and application of the Sandlot tools. The Sandlot project was begun in 2006, but it took some time for development and some time to build the patient base that was in the Health Information Exchange. So we went live in 2008. So we've been live on Sandlot for over 4 years now. And in my opinion, as a clinical gastroenterologist in the practice every day, is probably the most significant advance in healthcare that I've experienced in the past decade, as far as improving the quality of care and lowering the total cost, improving the value of care delivered. I just wanted to spend a little extra time today telling you some stories about my experiences with some patients in my office as a gastroenterologist that have evolved over the past several years since we've been using Sandlot to provide clinical information for me in the office at the time of care. It was actually very early on when Sandlot went live that we had a patient present to our office who had not been seen actually for a number of years. We did not have a current paper record on that office for that office visit. The patient actually collapsed in our waiting room, and not having any significant information about the patient, we were ready to call the ambulance and have the patient taken to the emergency room, I was able to access Sandlot and immediately found a wealth of information about the patient's physicians, the patient's diagnoses, medications, a recent hospital admission, and other vital facts that allowed us then to provide the care the patient needed in the office with full recovery and a management plan that allowed the patient to go home, not go to the emergency room, and do very well. I think it was at that moment that I first appreciated the profound value of having some of the vital clinical information that's provided by Sandlot at the point of care with a patient, in this particular case, somewhat dire straits. There's been, of course, quite a number of stories since then. One of my favorite was the patient who has come to see me for colonoscopy and for removal of a large polyp in the colon, and had given me her medication list and was getting ready to be scheduled for the procedure. I accessed Sandlot and reviewed the medications and found, to my surprise, that Coumadin, which is a anticoagulant, a blood thinner, was on her medication list. When I asked the patient about the medication, she said, yes, I am on Coumadin, but I just started it a few weeks ago and actually forgot to put it on my own medication list. Here is one very small piece of information that is extremely important in that patient's care that was provided at the time I needed it through Sandlot. This made a significant difference in how we planned the colonoscopy and the patient's management, and could have easily precluded a serious bleeding complication, a hospitalization, a transfusion, possibly even surgery as a result of not knowing all of the relevant medications for this patient. This happens actually quite often. Probably about a quarter of the patients that I see as a gastroenterologist are seen in the office for various stomach or bowel symptoms. And unfortunately, many of those symptoms derive from a medication adverse effect. They don't have an illness that is gastrointestinal in origin, but they simply have symptoms such as nausea, abdominal pain, diarrhea, or constipation, all of which are directly related to medications. If I don't have a complete list, complete access to the medications they're taking, then I can't make the right judgment about how to manage the patient. Oftentimes, unnecessary tests could be scheduled. Sometimes you prescribe one medication to treat the patient's symptom when the solution is simply stopping a medication that's causing the patient's symptoms. So Sandlot providing me a complete list of all the pharmacology that a patient is taking frequently makes a huge difference in the ability to manage that patient's care. I'm always surprised at how difficult it is for patients to remember not only their medications, but sometimes their diagnoses and problems, and very often the names of their physicians. It was interesting that just this morning in clinic, I saw a woman who had an incision on her neck with fresh sutures in it. She had had a carotid surgery, and when I said, well, who did your surgery? She couldn't remember the name of the cardiovascular surgeon who had just done the surgery a few weeks before. Well, this is quite relevant. When I'm seeing patients and trying to coordinate care with patients who have multiple systemic illnesses, they're on multiple medications, I really need to communicate with all of their physicians, and their physicians need to communicate with me in care delivery. If you don't know who they are, you can't do that. And fortunately, that information is readily available in Sandlot, which enables me then to be more effective at communicating what I'm doing to other physicians and allows them to communicate more effectively with me.